Like all individuals, however, people with autism have unique personalities and combinations of autistic-like characteristics, and these personalities and characteristics coalesce to create a person who's unique like you and me, but has personalities that are layered with areas of communication and social interaction and mannerisms that are unique and different than what you would see in a typical individual. Rather, you would see atypical behaviors that are describing that I've described to you. Many children and adults with autism have the ability to make eye contact. Others don't. Some show affection. Some don't. Many laugh, smile. Some choose or have different ways of communicating these feelings of emotion. But generally, again, different than typically developing individuals express themselves. Let's see. Autism is treatable. Children don't outgrow autism, but studies show that early diagnosis and early intervention lead to significant improved outcomes for people with autism. In terms of young ones and early intervention, when do you know if somebody might have some symptoms of autism? Lack of spoken language is one of those indicators. Repetitive use of language and motor mannerisms like hand flapping and twirling objects. Little or no eye contact. Lack of interest in peer relationships. Lack of spontaneous or make believe play, and persistent fixation on parts of objects, wheels, the train part that is more in particular attention grabbing than the whole train, and playing with the whole train, and doing so that is outside of what typically other peers would do when they played with toys and had interest in objects and things like that. Uh, when we look at autism, we look at communication, and communication and language is really important. Communication is possible without typical language like words and grammar. The problem of autism spectrum disorders is unacceptable communication behaviors, crying, hitting, screaming, hyperactivity. This is all, in many cases, can be addressed with functional communication, so that people who are unable to speak words or use grammar can express themselves. People can understand people who have autism, and so that we can live together in harmony. Language training can reduce inappropriate communication behaviors, and so language training is really important. Language problems with people with autism have to do with excessive screaming, crying, aggression, echolalia, excessive perseverations, and hypersensitivity to some sounds. And so these excessive areas cause problems in language for people with autism, but there are also deficits. Deficits like nonverbal, hyperlexia, literal use of language, so not understanding how language can be flexibly used, auditory processing problems, motor planning, having a challenge to interpret nonverbal NV, nonverbal cues, affect that doesn't match how somebody's feeling, or no affect, no spontaneity, or having a hard time generalizing, and having generalizing something that we learn from one area and moving it to another area, because we often learn a skill that can be used in different environments under different contexts. When people with autism are looking to, people with specialists are looking to work with people with autism to help assess language and communication, these assessments should identify verbal deficits, be ongoing, include formal and informal tools, so notes, case notes, and or assessment tools that professionals use. We should be exploring people's skills in a variety of contexts: home, school, and in work, with peers, different conditions, and people with autism and specialists begin to do formal and informal trials in parent teaching and teacher teaching and having a collaborative approach to the assessment and then the development of a language program. And then, of course, we want to have a good language program that guides learning and growth. So what is a language curriculum? What it might look? We look at structural or functional goals, learning to attend, imitate skills, imitation skills, looking at symbols and words to motivate that are motivating and that can be taught quickly so that we can see successes in young kids. And moving on to choice and dissimilar words, symbols relevant to using frequency so that we can teach the appropriate and simple and frequently used language first. There's a lot of guides, published curriculum on teaching children how to meet milestones and learn language skills, and functional assessments and functional skill assessments need to be done so that you can match the needs of each unique individual to the functional communication tools that they need. And then, of course, when we're working with people with autism, we want to develop both functional and developmental approaches to looking at teaching skills. Looking in terms of language, again, as an example, we want to look from a developmental, you could teach based on how somebody's age is and what they should be learning during those times and what behaviors they logically should be following, versus a functional language when you are really looking at a language that gives information, that gives the listener the idea that they're believing and they're listening and they're feeling what's happening and expressing tense and problem solving, and making and maintaining social contact. So you've got sort of two approaches. You've got a milestone approach, skill development, teaching skills to children based on their developmental age and needs, which is important. And then you have the functional aspects of language, which really talks about how we interact with each other and solve problems and make use of language. So both really are important. The functional approach will meet the individual's needs. The developmental approach is more about where a group of people would move along a curricula. In terms of teaching strategies in autism, there are indirect and facilitative to teaching strategies, discrete trial teaching, or a formal behavioral teaching that takes place for young people with autism. And I encourage you to explore the discrete trial or IBI literature if you're interested in young people with autism and intervention. Milieu teaching, which is interactive in the context and the moment of where people are. Kids are observational learning, where we learn by seeing and imitating, and expansion learning, and joint action routines where we do activities side by each and learn together. In autism, there are two types of teaching, which the discrete trial teaching, which talks about skill acquisition, fluency, and moving through stages, getting good at a skill and moving on. The discrete trial is a scientific approach where you target behaviors or skills, you teach those skills, you track the data to determine whether somebody has acquired the skill, and then you moved on. And this involves instruction, prompt, response, consequence, inter-trial intervals. And one who is interested in teaching people with autism, especially young people with autism, would be learning to do this kind of work where there's an instruction and a prompt, a response, a consequence, inter-trial, and interval behavioral paradigm that is tracked to provide the evidence that informs the continual skill development and acquisition of skills in young people and moving them along to be able to make sure that you have as much skill development happening as possible for the time being spent doing the teaching and learning in the discrete trial paradigm. The milieu interactive paradigm is where generalization and spontaneity happens, where teaching can take place in the the place or the context of the individual, where we model, where we teach manding and requesting and time and how to delay time and to incidental teaching. And in this moment, you can really shape skill development within the milieu in the interactive context. The combination of behavioral interactive methods is best where you do discrete trial format, which seldom produces spontaneous language and generalization, where the milieu combines interactive and behavioral models to spontaneity and generalization, but also is not as efficient on the skill acquisition side in terms of keeping a robust skill development program going. So the combination of both the interactive and behavioral methods help people with autism learn best and acquire both skill and quality of life. It's important to remember that language intervention requires knowledge of skills such as shaping, prompting, fading, chaining, and reinforcement. These are skills that are the tools of the specialist who understands behavior interventions. As child and youth care practitioners, you are to understand there is a paradigm, there is a behavioral approach, there is certainly a lot of literature out to help you understand these concepts, and that staff working with people with autism surely not only understand the concepts and teaching concepts of the behavioral paradigm, but also, and you will learn these concepts as a student in your third year in your behavior interventions course, the concepts of shaping, prompting, fading, chaining, and reinforcement and behavior interventions, but also that you understand about augmentative and alternative communication and communication aids and strategies, so that you are a part of a practice that honors communication for people with autism. We have good tools and assessment tools and curriculum and data tracking systems that are available and essential, and specialists that really are practitioners in the area of applied behavior analytics to identify the needs and starting points and what to teach, both verbal, nonverbal, behaviorally for children with autism. So any good autism program would start off with a good assessment of needs and then building upon a curricula depending on the individual and the context of the organization and how they set their goals around teaching and learning for people with autism. In terms of the sources I used for this particular lesson, I want to remind you that you have lots of really good material out on autism. First of all, I encourage you to dig into the DSM-5 and explore the autism spectrum disorders. Your challenge this week is to find them in the DSM-5, and they are there. And I also suggest that you explore some of the resources I suggested here, which is the Autism Society of America, which is certainly a large organization, the Autism Society of Ontario, the Geneva Center for Autism, and I've linked you to some really good articles on autism and communication. And finally, if anybody's interested in autism and in behavior sciences, look at the Autism Behavior Sciences curriculum that's out there, both in Ontario. Georgian has an Autism Behavior Sciences program that's linked to a consortium across the province, and I've also put a great deal of content on our shell around other aspects of autism that I thought would be explained well by others who are experts in the field, so please pay attention to those as well. Thanks and have a good week.